ion exchange rosins, you'll see a few patients who have potassium problems you'll see on camcorder.
Evil.
What it does is replace potassium ions for sodium ions, and this happens in the large intestine. It may temporarily, underline, circle, highlight, whatever, temporarily decrease potassium levels in the renal patient, and can be given orally or by way of retention enema.
You said replace potassium. The very first thing you said, replace potassium
for sodium ions.
Oh. Okay.
In the large intestine. Okay, so the side effects would be constipation, diarrhea. So you could go from one extreme to the other. Patient may have nausea and vomiting.
I've only ever seen diarrhea. I didn't know constipation was the side effect.
And low potassium, magnesium, and calcium can occur. So these levels may get lower than you want them to. So this should not be taken unless somebody has a problem with high potassium. The whole purpose in giving this is to decrease, and your patient teaching would include this, that camcorder is used to decrease potassium, blood levels of potassium, and should only be used as ordered. And patients who are on this should be encouraged to limit their potassium intake as instructed by the dietitian. Okay, something that we had seen a few times 20 years ago or so, and then we hadn't seen for years. Excuse me. We hadn't seen for years and years and years, and then all of a sudden it made a big resurgence, and that's IDPN. IDPN stands for intradialytic parenteral nutrition. It's an IV form of nutritional support for patients with hypoalbuminemia. And what it is an emulsion of amino acids, lipids, and dextrose. Okay, so the patients with low albumins, very low albumins, are the ones that qualify for this. And we want to treat patients with low albumins. The problem is that you've got to get coverage for this. This is not something that Medicare wants to pay for. So some patients qualify for coverage, some patients don't. But you know that you've got to get, in order to increase that patient's chances of survival, you want to increase. I see a look on your face. Or
amino acids, dextrose, and
lipids.
Lipids.
Patient survival is dependent on having an adequate albumin level. Patients with really low albumin levels will not be around for long. I mean, their morbidity and mortality rate is really high. Okay. Patient teaching, the patient needs to know it will increase their protein and nutritional levels. However, it's to be given at a prescribed rate. You do not want to give it fast or speed it up. It can increase insulin production. Even non-diabetics can have a severe insulin reaction with this because it's such a concentrated amount of dextrose. Now, the IDPN that they use now does not have as high concentrations of dextrose like what we used to use. So that's good.
So is this an irritant, like when it goes into the fistula? Because is it fairly close to TPN?
It's sort of like TPN in a sense. It doesn't have the same ingredients, but the other thing is, by the time it gets to the fistula, it's diluted with blood because it's given in the venous drip chamber. So, like for URNs that are giving meds, you might consider getting your other meds in first before you start. You know, getting your other meds in first before you start the IDPN.
Okay.
Okay?